Welcome back, everybody. We are kicking off Save My Sanity Week. Very important segment for any of you who wish to save your sanity. We're hoping that Gelman has got his notebook handy and his magical pen, and he's writing it all down. We've got signs and solutions for very common mental health problems. And here to help us recognize and overcome some issues is a psychiatrist and author of Self-Healing Mind, Dr. Gregory Scott Brown. Good morning, Dr. Brown. How are you?
Good morning, Kelly and Ryan. Listen, I'm just so pumped to be here because we're always thinking about mental health, but we're not talking about it enough. So thanks for having me on.
We appreciate it. I think you're more important now more than ever. People are struggling. Is it too late for us? Should we just not deal with it at all and put my head back in the sand, hide back under the bed? Or how do we recognize if we have a really serious problem?
Listen, it's never too late. And I'll tell you, I'll just start off by introducing my own story. So although I'm a psychiatrist, I'm someone who struggled with depression 2 decades ago. One of the reasons why I wrote the book, The Self-Healing Mind, was to really introduce to folks that self-care, things like spirituality, sleep, nutrition, breath work, movement, it's evidence-based medicine. And I think it applies to all of us today, now more than ever before.
And doctor, many people have obsession. What are the signs that one has an obsession or OCD, and what are the solutions to that?
So it makes sense, right? I mean, we're all hanging out in our Zoom caves these days. We're not going into the office as much. We have more time on our hands, and with time comes the opportunity to worry, to ruminate, even to obsess. Now, the good news is that most of us don't meet the threshold for the clinical diagnosis for obsessive compulsive disorder. That would be spending an hour or more a day with severe intrusive thoughts. Some people with OCD even exhibit repetitive patterns like counting, making checklists, and you notice a significant decline in your performance at work and at home. Now, if that sounds like anyone watching, it would make sense to pick up the phone, call someone like me. We have great treatments for OCD. But that doesn't mean that most of us don't experience these OCD type moments where we get stuck in our own thoughts. And just a couple of things that we can do is do something like exercise, mindfulness, meditation. That's really effective at helping to distract from obsessions. The other thing I like to recommend that sounds counterintuitive, but it totally works, is to actually set a timer, 15 minutes twice a week. Give yourself an opportunity to obsess, obsessively send your emails, obsessively scroll through your phone, write down your obsessions. I mean, you'd be surprised, 5 or 10 minutes into that exercise, you're done obsessing, you're ready to move on to something else.
Doctor, what if 15 minutes is not enough? What if twice a week is not enough days?
Kelly, you can give yourself 5 days a week, up to an hour. I give you permission to do that.
Thank you, Dr. Brown.
We have a lot of intrusive voices in our head all the time, doctor. We'll come back more with Dr. Brown right after this.
Okay, Dr. Brown, we want to get right back into it. What about burnout? A lot of people suffer from burnout. How do you spot it besides just telling yourself that you have burnout? How do you take action against it?
Right. So if you're feeling wired and tired, if you're feeling unmotivated to get up and go to work, if you're feeling underappreciated, these can all be signs of burnout. The thing about burnout is that in the medical community, we don't really have a clear way of defining it. So if you feel like you're burned out, you probably are. That's where self-care really comes into practice. So focusing on sleep, focusing on your nutrition, moving your body, developing a meditation practice can definitely help. The thing about burnout is you don't want it to end up evolving into something more serious like major depressive disorder. So it's important to take steps early on to prevent that from happening. Kelly and Ryan, another question that I get a lot about these days is ADHD. I mean, everyone feels like they have it. So the important thing to think about ADHD is so many different things can cause trouble with attention, concentration, focus, from anxiety to depression to spending your whole day in the same room like we're doing these days with the coronavirus pandemic going on. So it's important to also manage those other mental health issues that might be contributing to ADHD. But if you have it, we have great treatments for it, and it's an easy screen in about 10 minutes.
You know, one thing that I think, to speak for you, you would say that you're in this category as well, that we like to please people. Kelly and I are people pleasers. I think that we think it's a good thing, but I understand it's not necessarily a good thing to do that all the time.
Well, Ryan, it can be a good thing. So altruism or selfless service is actually beneficial for mental health. You know, this idea that doing things for other people can give us a sense of purpose, help us stay motivated. But if you notice that every time you go out to lunch with your friends, you're the one footing the bill, or if you're in a relationship where you're overly accommodating to your partner, then you're venturing over into that people-pleasing territory. Now, it's important to maintain balance. If you're feeling drained and burned out by doing things for other people, it's important that we, be a little selfish. That's really the best way to be able to take care of ourselves so that we can take care of the people around us. It's okay, Ryan, to be selfish every once in a while.
Okay, but Tubbs, next time, you pick up the tab?
It's okay to say no. It's okay to say no.
It's okay, right?
It's a powerful word.
Yes,
Dr. Brown, thank you very much for joining us. There is his book right there. You can get that where books are sold. And we'll be right back.